Dear President Obama, I am Roger Hartley, an internist at Ravenswood Hospital, Chicago. Healthcare reform is a Gordian knot that needs to be cut, and I applaud you for bringing health insurance to the uninsured. But to make this system affordable, we must all make concessions. Patients must abandon the "I want the test so I should get it" attitude. Doctors need to order fewer tests. And lawyers need to do their part too. You said it yourself to the American Medical Association in 2009, it will be tough to make some of these changes if doctors feel like they are looking over their shoulders for fear of lawsuits. Listen, doctors emerge from malpractice lawsuits battered and angry physicians and return to their practices with bitterness, cynicism and wariness. They practice CYA or cover your ass medicine and order more and more tests to avoid being legally vulnerable. Doctors estimate 25% of the tests they order are for defensive medicine. Lawyers say this figure is closer to 2%, but even 2% of our country's $3 trillion healthcare expenditure is $600 billion. That number alone should put tort reform on the map. But why doesn't it happen when 70% of the American people believe that some sort of tort reform is necessary? That is the elephant in the room, President Obama. Another quote from you during the 1996 Illinois State Senate race makes it seem like this was a long time ago. Anyone who denies there is a crisis in medical malpractice is probably a trial lawyer. Meaningful healthcare reform in this country cannot occur without some sort of tort reform. Lawyers need to do their part to make the system affordable. Here's how medical malpractice should work. Take the blame out of the system. Let doctors practice with skills and clinical judgment. Of course we are human, and when I make a mistake I should be able to admit it, advise my patient to file a claim, and tell them I'm sorry. I would like them to know that I did my best. Sometimes an apology is more healing than a long-delayed financial award. As a bottom line, I agree with the House Speaker from Maryland. Tort reform shouldn't be about doctors, it shouldn't be about lawyers, it should be about patients. A system should be designed to let the doctor enter a no-fault plea after a medical mistake, which would help instill honesty. Take the unpredictability and wackiness out of the system by appointing special medical panels to help process these no-fault claims. Take these cases out of the courts and let judges chosen for their medical and legal knowledge decide these cases quickly and rapidly. Award a fair settlement to cover the injured patient's medical bills and lost wages. Limit pain and suffering awards to $250,000. This is the home run part of malpractice that promotes greed and profiteering out of a patient's infirmity. Clearly, the system is broken, President Obama. There are 800,000 licensed doctors in America, and soon 34 million patients with government-subsidized health insurance will be looking for new physicians. I'm sure you know it has been predicted there will be a shortage of 167,000 physicians by the year 2025. Mr. President, you need to keep my generation of physicians working longer before retirement. You need to attract the brightest minds to medicine, but the balancing rewards are going away. Here is an example. I attended a staff dinner a few weeks ago where the speaker asked the group of doctors how many present wanted their children to grow up to be doctors. Only one other doctor and myself raised our hands. This, I find sad. When politicians and businessmen decide on healthcare policies, please don't forget about the doctors. With a little compromise on tort reform, most doctors would just as soon march with Obamacare as against it. Thanks. I'm Roger Hartley. Bye.